Hello, Dr. Vicki Peterson here. I wanted to speak with you a little bit today about some more information about vitamin D. As you probably know, it's very good for bone building, it's anti-cancer, it's also antiviral. So this is a good time of year with winter approaching to talk about that because colds and flu start to become more abundant, and both of them are caused by viruses. So you might, hopefully you've gotten your vitamin D level checked and you know where you are. Hopefully you also remember that the type of vitamin D we're taking is vitamin D3. That's the one that's best absorbed and best changes your D status, not vitamin D2, but vitamin D3. I find the liquid form is very good. I take it in a form that's in olive oil, so it's a couple of drops on the tongue. So it's very palatable, very easy to take. But so number one, I'd really like you to know your vitamin D status. It should be between about 50 and 75. That's a good level to have it. If you have cancer or you have a history of cancer, then on the higher end is better. But what if you're surrounded by someone who has a bad cold or flu? Maybe you're caring for someone in your family who's ill, or you suddenly feel like your immune system is weakening a little bit, you're getting some early signs that maybe you're getting sick. A tool that you can use is the antiviral abilities of vitamin D really respond to a megadose of vitamin D. Now you're only going to do this for 2 or 3 days. This is not an ongoing dosage, but for 2 or 3 days you can take 50,000 international units of vitamin D, and it really gives your immune system a very strong boost and is strongly antiviral, which is what you want for either the cold or a flu. So that's a strategy that you can use that should be helpful at this time of year. The other thing I wanted to mention is that there has been research on people who have been taking vitamin D, maybe a little too much for themselves, or they hadn't been really measuring it, either it got too high, or these were people who were taking a lot of vitamin D but they weren't really having the best diet. And specifically what I'm talking about is the fact that vitamin D works hand in hand with vitamin K. Both of them are fat-soluble vitamins. And if you get too much vitamin D and you're deficient in vitamin K, what can happen is you'll turn vitamin D's ability to make the bones strong into a negative, which is vitamin D starts depositing calcium in soft tissues of the body. So you could create kidney stones as an example. That would be calcium in the wrong place. You want it in your bones, not in the soft tissue. Now vitamin K is pretty easily gotten from things that I think should be an integral part of your diet already, which is all those wonderful dark green leafy vegetables. Brussels sprouts and kale and spinach and all of those. So you can do a quick internet search and get the full lineup of all the things that are high in vitamin K. But if you have those in your diet, then it's unlikely you're going to be deficient. You know if nothing green crosses your lips, and then you probably want to look and get a vitamin K level and see if you're deficient or not. Regardless, I would definitely recommend that you up your vitamin K status via all those dark green leafy vegetables, organic if you please, because those are going to stand you in very good stead in many areas of health. So our two issues today about vitamin D is one, you can do a bit of a mega dose of vitamin D3 if you suspect a cold or flu coming on. Remember, it's only for 2 or 3 days. And also to get your vitamin K status checked along with vitamin D and see where both of those stand. So I hope you find that very helpful, and I wish you a healthy winter. And until next time, I wish you very good health.